Good morning, everyone. At the outset, I wish to thank the organizers for the invitation to participate in this webinar. Our current research focus has been to develop reliable cellular models for breast cancer subtypes, drug-resistant breast cancer stem cell models, and growth inhibitory efficacy of natural products. In this presentation, I will discuss the recent data relevant to our research focus. Next slide, please. The progression of early stage breast cancer to advanced stage metastatic disease represents a major cause for mortality in women. For example, American Cancer Society has estimated for 2022 about 281,550 new breast cancer cases and about 43,600 breast cancer related deaths. General therapeutic options for the breast cancer are multi-drug combination of chemotherapeutics and molecularly targeted small molecule inhibitors. These therapeutic options have major limitations, which include systemic toxicity, spontaneous or acquired therapy resistance, drug-resistant breast cancer stem cells, and risk of advanced stage metastatic progression. Next slide, please. Because of these limitations for the conventional and targeted therapy, there are certain focus on the current research which are focused to develop testable therapeutic alternatives. And in this focus has been emphasizing on natural products and cancer prevention. These natural products usually include dietary phytochemicals, micronutrients, or nutritional herbs, which are widely used in traditional Chinese medicine. And these alternatives may have advantages because of documented human consumption, low systemic toxicity, and preclinical efficacy. Next slide, please. So the presentation objectives for this talk are the cellular models. I would be showing some data on the luminal A aromatase expressing postmenopausal breast cancer and triple negative breast cancer subtypes. I would show data for inhibitory efficacy of Chinese nutritional herbs on parental cell lines, data on the development of drug-resistant stem cell models, and mechanistic leads for experimental modulation for stem cell targeted therapy. Next slide, please. This slide is a general slide which shows natural products which have been tested in literature for therapeutic alternatives. The nutritional herbs are mostly Chinese nutritional herbs, which include Cornus officinalis, Dispacus asperatus, Epimedium grandiflorum, Lycium barbarum, Soralia coryliflora, and Savibuya evelandi. And the second column shows the actual source, and the third column shows the documented bioactive compound in the drug, in the plant extract. Usually, we use non-fractionated aqueous extract for testing because that is how the patients have been asked to take these nutritional herbs. They just boil the herbs and then consume the essentially the boiled tea. As far as the phytochemicals are concerned, I would be showing some data on endogenous derivative of vitamin A called all-trans-retinoic acid, and a terpene which is called carnosol present in rosemary. All-trans-retinoic acid is a retinol derivative, vitamin A derivative, whereas carnosol is a naturally occurring terpene present in rosemary. Next slide, please. This slide shows the breast cancer overview of existing therapeutic modality for different subtypes of breast cancer. The major therapeutic modality, as I mentioned earlier, is multi-drug combinations of various chemotherapeutics, cytotoxic agents, which is used for luminal A and luminal B. Selective estrogen receptor modulators, selective estrogen receptor degraders, and aromatase inhibitors are used for postmenopausal breast cancer, which expresses aromatase enzyme. The HER2 inhibitors are used for luminal B, which expresses the human epidermal growth factor receptor 2 or HER2 oncogene, and the HER2 enriched subtype of breast cancer, which is mostly ER/PR negative but expresses HER2 oncogene. In the triple negative breast cancer, again, we have the multi-drug chemotherapeutics and molecularly targeted therapeutics for because triple negative breast cancer lacks the hormone receptors and the HER2 receptors. The testable alternatives documented in literature include phytochemicals, herbs. Most of the phytochemicals also are estrogen, phytoestrogens, and potential estrogen receptor beta agonist. Estrogen receptor beta is a well-documented negative growth regulator. In addition, we have data to show that T polyphenols, soy isoflavones, terpenes, and vitamin A derivatives or retinoids have been used for HER2 for the luminal B and HER2 enriched breast cancer subtypes. And for triple negative breast cancer, I will be showing some data for the Chinese nutritional herbs. Next slide, please. This slide is the list of experimental models or cell lines which we have been used for our research. 184B5 is normal breast epithelial cell, which is non-tumorigenic, does not form tumors. It lacks estrogen receptor, progesterone receptor, HER2, and aromatase expression. The MCF7 is a luminal A type of subtype of breast cancer, which expresses estrogen and progesterone receptor, but lacks the expression of HER2 and aromatase. We also have MCF7, which has been stably transfected with aromatase gene as a model for postmenopausal aromatase expressing breast cancer. These are ER/PR positive cells, HER2 negative, but positive for aromatase. And MDA-MB231 is a cell line for triple negative breast cancer, lacks the expression of ER/PR, HER2, and aromatase. Next slide, please. Now, this is a general slide which shows the growth pattern of these cells. The 184B5, as I mentioned, are non-tumorigenic cells. They do not form anchor-independent colonies and do not form tumors on transplantation. We have seen these transplanted recipients for 24 weeks, and we did not see any tumors. In contrast to these 184B5, 184B5 HER2 expressing cell line, MCF7 and MDA231 shows substantial increase in anchorage independent colony formation and faster growth of tumors within a span of 3 to 5 weeks. Now, I should mention here that anchorage independent colony formation or AI colony formation is a specific and sensitive surrogate endpoint for in vivo tumorigenicity. So most of the cell culture experiments from tumorigenic cell lines use this to confirm that the tumorigenic potential is maintained in vitro, which is represented by a number of anchor-independent colonies. Next slide, please. Now, these are general endpoints which we have used. For example, in AI colony formation, the number of colonies, cell cycle progression, we use the ratio between G1 and S plus G2M. Cellular apoptosis is % sub-zero population, caspase 3,7 activity. For estradiol metabolism, I would be dealing in a little bit detail later on. We use the expression of two metabolites ratio, the 2-hydroxyestrone and 16-alpha-hydroxyestrone. Aromatase activity is measured by conversion of androstenedione to estrone. RB signaling is quantified by ratio between phosphorylated RB and total RB. And most of the antibody uptakes are relative fluorescence units. Next slide, please. This slide shows the estrogen metabolism pathway. First, basically, the aromatase enzyme, which converts androstenedione to estrone and testosterone to estradiol. Now, as I mentioned earlier, this aromatase enzyme is a clinical marker for post-menopausal breast cancer, which has expression of estrogen receptor. Now, this estrone formed functions as a common precursor for two metabolites. One is 2-hydroxyestrone, and the other one is 16-alpha-hydroxyestrone. And the important properties of these are that 2-hydroxyestrone is a potent anti-proliferative and pro-apoptotic metabolite of estradiol, whereas 16-alpha-hydroxyestrone promotes cell proliferation and sometimes induces mutation. So therefore, because of these differing properties, growth modulating properties of these two estrogen metabolites, we usually quantitate the change in the estrogen metabolism by looking at the ratio between 2-hydroxyestrone and 16-alpha-hydroxyestrone. Next slide, please. Now, most of the methods used for the estrogen metabolism assay are tritium exchange assay, where the cells are treated with stereospecifically labeled tritiated estradiol, and we measure the formation of tritiated water, which depends upon the stereospecific label, and therefore the endpoint is formation of tritiated estrone, tritiated estrogen, 2-hydroxyestrone and 16-alpha-hydroxyestrone formed. The data is usually expressed as dpm per 10 to 6 cells and at the ratio between 2 and 16-alpha-hydroxyestrone. In addition to that, more sensitive assay has been now recently used, which is called the GCMS assay, the gas chromatography molecular spectroscopy assay, which usually is calibrated with deuterated estradiol, and we monitor the elution times of estradiol, estrone, 2-hydroxyestrone, and 16-alpha-hydroxyestrone, and determine the molecular mass of all the two metabolites. And endpoints are metabolite formed in nanograms per 10 to 6 cells, and again, 2 versus 16-alpha-hydroxy ratio. Next slide, please. In this model, we have used the MCF7 model to look at the effect of various estradiol metabolites. We have quantified the effects by looking at the anchor-independent colony number and the tumor weight. Obviously, the anchor-independent colony number is the in vitro cell culture model, whereas tumor weight is where we have injected the MCF7 cells into nude mice and looked at the tumor weights. As can be seen, compared to the control, the cells which are treated with estradiol, which is E2, and 16-alpha-hydroxyestrone have increased number of anchor-independent colonies as compared to 2-hydroxyestrone, which has substantial decrease in the anchor-independent colonies. Essentially similar pattern is seen in the tumor weight. The recipients which are treated with estradiol and 16-alpha have larger and heavier tumors, whereas those treated with 2-hydroxyestrone has substantially decreased tumor weight. Next slide, please. The same MCF7 model has also been used to look at the inhibitory effects of selected Chinese nutritional herbs. I'll just read out the abbreviations here. LB is Liaisons barbarum, CO is Cornus officinalis, and EG is Epimedium grandiflorum. We are looking at the ability of these extracts to inhibit estradiol promoted growth in ankyrin-independent colonies. And as clearly seen here, that estrogen in the presence of LB, CO, and EG has substantial decrease in the number of ankyrin-independent colonies. While if you look at the ratio of 2-hydroxyestrone and 16-alpha-hydroxyestrone data compared to E2 control, EG, LB, and CO has increased ratio of 2-hydroxy over 16-alpha, and mostly it is because of the increased formation of anti-proliferative 2-hydroxyestrone metabolites. Next slide, please. Now, moving over to MCF7 row model, where MCF7 has been, cells have been expressing aromatase gene. We have looked at the efficacy of Tabebuia ovulandi. Here we are actually looking at some estrogen responsive genes. The ESR1 is the gene for ER alpha, estrogen receptor alpha. Excuse me. Aromatase gene is for the aromatase, and progesterone PR is the progesterone gene. And we've shown here that in the presence of treatment with Tabebuia ovulandi, the gene expression of these three genes, ESR1, aromatase, and progesterone, are substantially decreased. Next slide, please. We also looked at other set of estrogen regulatory genes, which are called PS2, GRAP2, and cyclin D1. Again, we see the same pattern, that in response to Tabebuia ovulandi, the expression of PS2, GRAP2, and cyclin D1 are substantially decreased. Next slide, please. Here we are looking at the induction of cellular apoptosis in the presence of Tabebuia ovulandi. Apoptosis is measured by caspase-3,7 assay and relative expression of anti-apoptotic BCL2 and pro-apoptotic BAX gene expression. As can be seen here, the treatment by Tabebuia ovulandi, or TA, increases caspase-3,7 activity, suggesting it's a mitochondrial intrinsic increase in the apoptotic activity. In addition to that, anti-apoptotic BCL2 is downregulated, whereas pro-apoptotic BAX is upregulated in response to Tabebuia ovulandi. Next slide, please. Here we are looking at some of the comparisons of Tabebuia ovulandi with clinical aromatase inhibitors. For example, in this slide, we are showing the effect of letrozole. Usually, in the in vitro cell culture assays, you use about 1 to 10 micromolar of these aromatase inhibitors, and depending on the molecular weight, it converts to 285 nanogram, whereas the bioactive component in the TA, which is called nitrofuranodione, or NFD for short, the concentration of that bioactive agent is 8 nanograms. So if you compare the effective concentration of these two compounds, showing roughly comparable aromatase activity, it shows that the potency of TA is about 35 to 36-fold greater than letrozole. Next slide, please. Next slide, please. You are missing one slide, I think. Is it? Can you go back one slide? Okay, yeah, thanks. No, just one. Yeah, that's the one. Here we are looking at the aromatase anti-aromatase inhibitor, or aromatase inhibitor called exemestane. Again, the same pattern. that is usually used in cell culture for 10 micromolar, which translates to almost 3,000 nanograms, 2,960, where the NFD is higher here to compare with the exemestane higher level, which is 20 nanograms. Again, 20 nanogram versus 3,000 nanogram shows roughly similar inhibitory activity for aromatase, and therefore the potency of TA is almost 150 or 148 times greater than exemestane, because much lower combination, much lower concentration used, which gives you comparative inhibition in aromatase activity. Next slide. We move to the next model, which is called MDMB231 model, which is a model for triple negative breast cancer. Here we are looking at the effect of select Chinese nutritional herbs. They have shown some mechanistic leads. Here we are looking at the ratio between G1 is to S plus G2M phase, cell cycle phase, which is basically ratio between the quiescent and the proliferative phase of the cells. Compared to control, the treatment with DA, TA, PC, and CO have increased ratio of G1 is to S plus G2M phase in preference to G1 arrest. And these data are arranged based on their rank order of their efficacy. We also looked at cyclin D1 expression. Again, these Chinese neutral herbs inhibit the cyclin D1 expression. And in this model, the RB is defective. The RB is a well-known tumor suppressor gene. And in the TNBC model, it has been shown that the normal tumor suppressor function of RB is defective. So here, what we are showing here that in the presence of PC, DA, or CA, and TA, the ratio of phosphorylated RB versus RB is substantially decreased, suggesting that it is trying to correct the defective RB signaling pathway. Next slide, please. Now, we have also looked at the pro-apoptotic activity of these Chinese nutritional herbs by looking at percent sub G0 or apoptotic cells in apoptotic phase of the cell cycle. As shown in this slide, this panel in treatment with PC, TA, DA, and CO, the percent sub-zero population is substantially increased. And parallel to that, the caspase 3,7 activity, which is a reasonably sensitive molecular marker assay for cellular apoptosis, that also shows the essentially similar pattern. Next slide. Now, moving to some of the data from cancer stem cells, there's a strong evidence in literature that various signaling pathways such as Wnt, beta-catenin, Notch, and hedgehog, these are regulatory signaling pathways that are active in normal cell population, which is responsible for cellular homeostasis of the target organs. And these are known to be disrupted in cancer stem cell population. In addition, that certain activated pathways, cell signaling pathways, are activated in the cancer stem cell population. These include RAS, BRAF, MEK, and ERK signaling pathway, and PI3 kinase, AKT, and mTOR pathways. And these activation of these pathways gives a growth advantage to cancer stem cell survival. Next slide, please. Now, we have used several assays to isolate and characterize cancer stem cells from these models. Of the assays, I would mostly show you the data of the tumor spheroid formation and surface markers CD44 expression and transcription factors NANOG and NOX4 expression. We have in the past used all of these assays, but found that tumor spheroid, CD44, and transcription factor assays seem to give reasonable reproducible data in our hands. And we have isolated the drug-resistant phenotypes from cells treated with tamoxifen, lapatinib, and doxorubicin, depending upon the specific cell type. For example, for MCF7 cells, we have used tamoxifen, which is estrogen receptor modulator. For HER2-enriched, we have used lapatinib, which is a pan-EGFR and HER2 inhibitor, small molecule inhibitor. And for triple-negative breast cancer, we have used doxorubicin, which is a mainstream cytotoxic chemotherapeutic to isolate the drug-resistant stem cells. Next slide, please. This is the assay we have used for looking at the antibody uptake of the specific antibodies against the transcription factors. Essentially, we are measuring the cellular uptake of the cells stained with the FITC labeled antibodies. and basically this micro shows, this figure shows that in presence of apoptotic inducing agent, there is substantial downregulation of anti-apoptotic BCL2 as seen by lack of cellular expression of the BCL2 antibody compared to control, which is has substantial expression of the antibody. Next slide, please. Now, the methods used for the immunofluorescence assays are basically staining of the cells with the FITC conjugated antibodies, the fluorescently labeled antibodies. The controls are staining with the fluorescently labeled IgG. Cells are monitored for cellular uptake by fluorescence-assisted cell sorting. Data is normalized by FITC IgG uptake, and endpoints are relative fluorescence units per 10 to 4 fluorescent events. Next slide, please. Now here we are looking at, as an example, I'm showing you the data for the triple negative MDA MB231 cells, which are treated, which are treated with doxorubicin, and the doxorubicin resistant phenotype shows increased growth and increased tumor formation. Next slide, please. Here we are looking at the expression of CD44, NANOG, and OCT4 in doxorubicin sensitive and doxorubicin resistant cell type, and the resistant phenotype shows increased expression. Next slide, please. I'll go ahead. Next slide, please. I'll skip this slide. I'm running out of time. Okay, I just want to show this slide where we have shown the mechanistic leads for experimental modulation of all trans-retinoic acid, vitamin A, and the terpenoid C-sol in the HER2-enriched breast cancer model, where we are looking at lapatinib resistant phenotype. In presence of all trans as well as, like, could you go back one more time? Back one slide, please. Back. Yeah, thank you. In response to ATRA and C-sol, the tumor spheroid number is inhibited, reduced, and similarly, the CD44, NANOG, and OCT4 inhibition is inhibited compared to the control cells. Next slide, please. I'll skip this slide. Next slide. Next slide. Next slide. So to conclude, we have shown the data that cellular models, that is parental cell lines, exhibit susceptibility for growth inhibition by testable therapeutic alternatives. Stem cell models, we have identified stem cell targeted therapeutic alternatives, and experimental modulation of the stem cell targeting effect of natural products mediated downregulation of stem cell markers. Next slide. Next, I'll skip this. Next slide, please. So just to acknowledge, I would like to acknowledge my collaborators, Dr. Nair from University of Texas, San Antonio, and Dr. Wong from American Foundation for Chinese Medicine. Next slide, please. And also I'd like to acknowledge past support, extramural grants from National Cancer Institute and Department of Defense Breast Cancer Award, and some philanthropic support from my former institution. And I'll stop here and take questions if you have. Thank you so much for your time.